Hello, my name is Abigail Velez, and today I'm going to talk to you about gingivitis complication. Definition: gum disease is a dental infection that can lead to several complications. The milder form of gum disease, which is scientifically referred to as gingivitis, refers to the teeth's surrounding tissue becoming inflamed, which is typically due to poor practice of oral and dental hygiene. In other words, gingivitis results in the inflammation of the gingiva specifically. This is the part of the gum that is found at the base of the teeth. Now we are going to watch a video about it.
With gingivitis, gingiva refers to the gums, and itis refers to inflammation. So, gingivitis is inflammation of the gums. With periodontitis, peri means around, and odon refers to the tooth. So, it's inflammation and destruction of the supporting structures around the teeth. Broadly speaking, the two are on a spectrum, starting with simple gingivitis on one end, and if the process doesn't get treated, it can develop into more severe disease, periodontitis, which is on the other end of the spectrum. Let's start by building a model of a tooth and its surrounding structures. In the mouth, the bone beneath the bottom row of teeth is the mandible, and the bone above the top row of teeth is the maxilla. Both bones have an alveolus, or socket, for each tooth. The socket's lined on the inside by a periodontal ligament. Protecting the alveolus on the outside is a layer of soft, supportive tissue called the gingiva, or gums, that sits on the top of the bone. The tooth itself can be roughly divided into two parts. The first part is the root, and it sits within the alveolus. The root is covered by a bone-like substance called cementum, and that's what the periodontal ligament's fiber is attached to. Next, there's a short zone called the neck, which is a transition between the root and the crown. The crown is the visible part of the tooth that protrudes from the gingiva, and it's covered in enamel. Enamel has such a high mineral content that it's the hardest substance in the human body. The portion of gingiva that sticks up and is not anchored to the tooth is sometimes called the free gingiva, and the space between the free gingiva and the crown is called the gingival crevice, or gingival sulcus. A watery substance called gingival crevicular fluid flows into the space in small amounts. Gingival crevicular fluid contains various immune proteins in cells like neutrophils, complement proteins, and antibodies. Within the mouth, there are a bunch of bacterial organisms. In a healthy mouth, there's a balance of commensal bacteria that compete with each other, and they're all kept in check by those immune factors. Gingivitis and periodontitis represent a state of imbalance, or dysbiosis. This is when there's a relative increase in pathogenic bacteria, either because of a lack of competition with other commensal bacteria, or because of an ineffective immune response in the mouth. The pathogenic bacteria form dental plaque, which is a sticky collection of bacteria, proteins from saliva, and dead cells from the lining of the mouth. Individual bacteria multiply and form a lot of small microcolonies that coalesce, creating a layer of dental plaque, which is a type of biofilm.
Application in dentistry. It's important to have regular dental checkups so any problems with your teeth and gums can be detected and treated early. If you have never had gum disease and have good oral health, you may only need to visit your dentist every 1 to 2 years for a checkup. But you may need to visit your dentist more frequently if you have had problems with gum disease in the past. And it's important, and each appointment your dentist will advise you when you need your next appointment. And if you have increased risks of developing gum problems, for example, you smoke or have diabetes, you may be advised to visit your dentist more often so your teeth and gums can be closely monitored. Now we are going to watch a video about it.
Hi, I'm Dr. Joe Nemeth. I'm a periodontist in Southfield, Michigan, and today I want to talk a little bit about a extremely common problem. In fact, 70% or more of our population has it, and that's gingivitis. Gingivitis means inflammation of the gingiva or the gum tissue. There are two kinds of gingivitis. There's plaque-induced gingivitis and non-plaque-induced gingivitis. Plaque-induced gingivitis is usually caused by lack of adequate oral hygiene or home care. Non-plaque-induced gingivitis can be a number of other factors. It can be viral, it can be systemic, it can be due to local exposure to other factors, chemicals. But the most common is the plaque-induced gingivitis, and that is the one that typically can lead to what's called periodontitis. And periodontitis means that it's involving the area more beyond just the gum tissue, but the surrounding supporting tissue of the tooth, the bone, to be specific. Now, periodontitis tends to be more severe. You start losing bone, you lose the support of the tooth, you lose the tooth. But if we can catch it in the gingivitis stage and eliminate the gingivitis, very often we can stop it at that point and prevent it from getting to the periodontitis or the more serious stage of bone loss and potential tooth loss. In plaque-induced gingivitis, some of the symptoms that we see are redness, bleeding, little tenderness of the gum. Sometimes there is not much in the way at all. So if we have a patient who comes in, we will automatically take a sample of the plaque and the bacteria that are in the plaque and see if there are pathologic or pathogenic bacteria and or parasites in there. And we can catch that and treat it early to prevent periodontitis. If it's very early, just really good home care, good cleaning at your dental office and good home care on your part, if you're taught properly how to do it, can eliminate the plaque that causes gingivitis and therefore very often eliminate the periodontitis that would follow. As far as home care is concerned, I think it's important to clean between the teeth, either with floss or interdental cleaners, so that you remove that plaque thoroughly between the teeth, because typically that's where gingivitis and periodontitis start. Brushing thoroughly, I'm not sure that the type of toothpaste that you use makes a real difference, but brushing thoroughly makes a big difference. Using a water cleaning device can also be very helpful, because sometimes cleaning between the teeth with floss and brushing doesn't remove everything as completely as it might, but the water cleaning device can stimulate the tissue and remove particles that may be missed otherwise. So really good home care is the key to treating gingivitis, the early stage of gum disease.
Pros and cons. Pros. Really doesn't exist pros about gingivitis because it's an oral disease, so it can affect anybody that doesn't to take care their oral health. However, we have cons. If gingivitis is left untreated, it can progress and spread to the underlying bone and tissue. This is when periodontitis occurs. This is a far more severe condition that may lead to tooth and decay and tooth loss. Gingivitis may develop further complications if you don't treat it. These include recurring gum abscess. It is painful collection of pus, increased damage to the periodontal ligament. It is the tissue that contains the tooth to the socket. increase the damage to and loss of the alveolar bone, the bone in the jaw that contains the socket of the teeth, receding gums, loose teeth, or loss of teeth. Now we are going to watch a video about it.
Gum health can be evaluated by bleeding. If there's no bleeding on probing, the area is healthy. If there's just a little point, it's good. A line down the side would be more inflammation, and then there's profuse bleeding that fills up the whole contact area. This is a healthy gum tissue. It's nice and pink. When it's probed, there's no bleeding. Here is a patient that brushes quite a little bit. So his gum tissue doesn't look so bad, but upon probing, you can see that there's bleeding. There's at one point just kind of like a little point bleeding, which you can see on that central, the lower left central incisor, and then the lateral incisor, you can see the line. So that's the difference between a point and a line. The line, though, is usually shows a lot more inflammation, which isn't a surprise because that particular tooth is crooked. It's a little further behind. There's probably material up underneath it. Here's somebody else with profuse bleeding. You look at the gum tissue and it moves very easily with the air. When we probe it, you'll see that the whole contact area fills up like a triangle upon just lightly touching it. And that's a mark that there's a significant amount of inflammation, that the gum tissue, the connective tissue is weak, and really is something that needs some significant work to turn that around. The next case and it has a lot more tartar and plaque. You can also see the irritation has affected the coloration as well. And in this particular patient, when we put the air on, you can also see it move, just like the other one, but the quality of the gum tissue looks a lot weaker. Part of that is that there's just so much tartar and plaque of the biofilm there. We just basically touch it a little bit, and you can see how the whole triangle appearance fills up. So when we're looking at gum health, if there's no bleeding whatsoever upon probing, then there's a point, then there's a line, and then there's the triangle. And the more bleeding there is, naturally, the more gum work a person needs to do. If they go in right away and floss, oftentimes they will hurt the gum tissue. If more of the extreme cases, it's better to have a dentist or a dental professional clean up the inflammation, possibly using a rubber pick. I also like tooth and gum tonic. It's a mouth rinse that also helps to treat the gum tissue.
Issue applied in Ecuador. Gingivitis occur in 3 out of 4 of Ecuadorians during their lifetime, but with proper dental care early on, it is easily reversed. If left untreated, gingivitis can develop into a more severe form of gum disease known as periodontitis, which is a major cause of tooth loss in adults. And finally, conclusion. Gingivitis doesn't often cause pain, so many people don't know they have it. In fact, as many as 75% of people in the world will experience some degree of gingivitis during their lifetime. That's why it's important not only to know what to look for, but also to see your dentist regularly for cleanings and checkups. Thanks for watching my video.